Did you know that millions of people around the world are affected by sexually transmitted diseases, also known as STDs or STIs? Many people still believe myths about how these infections spread. Knowing the real facts can help you protect yourself and the people you care about. Today we'll explain the 4 most common ways STDs spread and how you can reduce your risk. STDs are infections caused by bacteria, viruses, or parasites. Some may cause noticeable symptoms, while others may not show any signs for months or even years. Because symptoms aren't always present, regular testing is an important part of sexual health. Way 1. Unprotected sexual intercourse. The most common way STDs spread is through unprotected sexual intercourse. This includes vaginal, anal, and oral sex with someone who has an infection. Many STDs can be passed even if the infected person doesn't have symptoms. Using condoms or other barrier methods consistently can lower the risk of many STDs, though they do not eliminate the risk completely. Way 2. Skin-to-skin contact. Some STDs spread through direct skin-to-skin contact during intimate activity. Infections such as genital herpes and HPV can sometimes spread through contact with affected skin, even when symptoms are mild or not visible. Barrier protection can reduce the chance of transmission, but it may not cover every area where infection is present. Way 3. Blood-to-blood contact. Some infections can spread when infected blood enters another person's bloodstream. This may happen through sharing needles or other equipment that comes into contact with blood. Using sterile medical equipment and never sharing needles helps reduce this risk. Way 4. Mother-to-child transmission. Some STDs can be passed from a mother to her baby during pregnancy, childbirth, or in some cases, breastfeeding. The good news is that prenatal screening, medical care, and appropriate treatment can greatly reduce the chance of transmission for many infections. You can reduce your risk by using condoms or other barrier methods consistently. Getting tested if you're sexually active or have a new partner. Avoiding sharing needles or equipment that may be contaminated with blood. Talking openly with your partner about sexual health. Seeking medical care if you notice symptoms or think you've been exposed. Understanding how STDs spread is the first step toward protecting yourself and others. If you'd like to learn more about sexual health, prevention, and testing, visit NoSTDs.com. If you found this video helpful, please like, subscribe, and share it so more people can learn the facts. Stay informed, stay healthy.